Dr. Slaughter, thank you so much for joining us today and taking time to chat with us. Do you want to tell us a little bit about your practice at Conroe and how long you've been with Kelsey and a little bit of your background?
Sure. So I trained in family medicine and I joined the Conroe location here for Kelsey-Seybold in August of 2020. And I've been here since. It was an interesting time to come during the pandemic. I've also specialized in obesity medicine. So I'm also board certified in obesity medicine. That's one of my interests. But, in family medicine, we see a whole range of things. So
Awesome. So let's jump in and talk about communicating with your physician. Especially you mentioned during the pandemic, we know that it's been challenging for patients to feel connected with their physicians and feel like they're still receiving, the same, not amount of attention, but you just, that same connection as they would in person. So do you want to talk a little bit about how you've been able to communicate with your patients during COVID and the benefits of maybe communicating virtually with your physician?
right. I mean, technology has been a big help during the pandemic. It's, nice to be able to have the ability to do a visit if you didn't feel safe coming into the office yet, or if you didn't feel ready during the pandemic. Additionally, just so everybody knows, we are trying to do all of our sick visits still on the video so that if you come in for a well exam or if you come in to be seen in person, there's not really a huge risk of you being exposed to somebody sick. So, I've tried to, explain to my patients, hey, when you're sick, unfortunately at the time, for this time being, we're having to see you on the video. I know it's less impersonal. I can't do my full exam and get all the information I would get when you're here with me. But we're doing our best with that. When it's safe, we'll open that back up. But when you're well, or if you're following up on things that aren't, contagious things, come on into the office. We'd be happy to see you here for a well visit.
Perfect. So let's talk a little bit about anxiety. We know that lots of people put off going to the doctor because they're anxious, nervous, scared, embarrassed. A lot of emotions involved with, taking care of your health and talking to someone about it. Do you have any tips for easing anxiety and sort of making that first step if you're nervous to talk to a doctor about something?
Sure. I mean, I always remind my patients, don't be afraid to share something with us. I mean, we've kind of heard it all. And, we can help you with things that we know about. A lot of us are pretty good diagnosticians and clinicians, but we aren't psychic. So, if there's something that you really have a burning question or a concern and you haven't brought it up to your doctor, we may not know you're dealing with that. So, find a way that you feel comfortable sharing that or opening that conversation. I usually try to leave a time for questions at the end of my visit. So if for some reason I haven't asked the thing that's kind of you wanted me to ask, you have that time. But if you're in a clinical encounter and you don't have that opportunity, don't be afraid to say, I did have something else that made me make this appointment today. Because we're used to that. That's kind of a, standard in primary care. People come in and they have, something that brought them in that day. And just remember that this visit is about you and your healthcare and your well-being. So, just knowing that I'm here and I'm focused on you for that time that we're in the encounter together, I want you to make the most of it. I want you to have all your questions ready. I want you to be able to feel comfortable sharing with me and getting the answers you need and being comfortable saying, I don't really understand what you're saying, Dr. Slaughter. I don't, that doesn't make sense to me, because it doesn't really help if I answer your question, but it didn't make any sense. So, just finding a physician that you feel comfortable with, or just finding the courage to say, what, I'm not following, or I don't really understand why you want to do this plan. Please speak up so we know what's going on. And don't be afraid too, if you leave the visit and you think, I thought of a better question, or maybe I didn't understand. We're available. You can send my Kelsey message. You can call the office. You could leave. I've had patients leave me letters even, so there's multiple ways to get in touch with us and let us know that you had some additional thoughts or questions after the fact. Sometimes, people feel better if they prepare for their visit, maybe by taking some notes about things that they don't want to forget to ask, or, writing down, like, why am I making this appointment? What are things in my history that we need to know? Because I'm sure we've all experienced, you get in the door and they start asking you all these questions. Well, who had that? When did they have it? What do you take? So write all that stuff down so you feel ready and prepared. Another tip is maybe come at a time of day that's good for you. If you don't want to be rushed, you want to be able to take your time and ask the doctor all the questions you need to. So if you're like have 15 minutes between, drop off and pick up and, all these other things, maybe that's not the ideal time. If you could come at a time when you have a little bit to sit and, go over everything with us in detail, I think that helps. Another thing is a lot of times when patients are getting referred out of, family practice to see a specialist, they're kind of nervous. They're like, how do I know, how will I prepare for my specialist visit? I always direct them to the Kelsey website because all of us have profiles. And so you can watch a video, you can learn a little bit about your physician, you can see where they went to school, you can see where their clinical interests are, so I mean, you can kind of already know a lot about your doctor and kind of what the situation you're walking into is going to be like before you even get in the door. And sometimes that helps people feel comfortable too.
So what if you are having extreme anxiety about visiting the doctor? We know, especially maybe around immunizations or vaccines, some people really have a fear of needles. Do you have any tips sort of for relaxing or calming yourself down before your visit?
Right. Well, I mean, one thing I always tell patients is if you're really scared and you don't want to do labs today, I mean, I can order them for the future. The same thing with vaccines. We don't have to do that on the day you're coming. If that's going to be too much of an anxiety thing, talking to the doctor and getting poked with a needle and getting your lab, it's all going to be too much. We can space this all out if that helps. Other things too is just being honest with us. Just say, hey, I'm a little nervous, and and maybe that's why it's taking me a second to collect my thoughts. Letting us know you're a little anxious about those things. Maybe we can do something to, like I said, space out the planning of our, testing and stuff, or maybe offer you something that might make you feel more calm. We try to, make a very calm, place for you to do your visit. It's quiet. There's not a lot of distraction, but, I often tell patients during procedures, if listening to music is going to help you feel calm during this procedure, please put on your music. I don't mind sharing that, listening to that while we do this, or, if while you're preparing for the doctor to come in, if you want to have something to keep you busy, maybe it's a TikTok video, maybe it's reading your favorite book, because notoriously doctors are always running you a few minutes behind and leaving you waiting in the room to think about what's to come. So bring something that relaxes you, knitting, a book, something that is a good distraction for you while you're waiting.
So let's talk a little bit about language barriers. Some people, may speak a different language than English, or, English is not their native language or their first language. So how do you help patients in those situations where they may feel they have a language barrier from communicating with their physician?
Right. That's always something, we want to be aware of. So if you come in and, it's not been apparent from when you checked in that, English is not your first language, not the language you're comfortable communicating with your doctor and healthcare team in, please say something and let us know what language you would like to be using. At different locations, we have different certified translators. Here in the Conroe location, we have a certified Spanish speaker. But if you speak something besides Spanish, or if, for example, that translator was not available, we do have a translation line that we use for communicating. It's basically a 24/7 call number where they have pretty much every language available for us to, and they repeat everything I said and they repeat everything the patient said. So they basically word for word go through what you're telling me and then what I'm telling you. And so they don't have a time limit or anything. So, I mean, you can be on that translation line as long as you need. So that's one of the ways we conquer that barrier. Now, whenever someone messages me in a different language, we have a similar system for kind of, getting that into English and then translating my English response back to the appropriate language.
Perfect. So what about if someone tries to contact you in the weekend? We know that, when patients get sick, it's not always perfectly timed between 8 to 5 office hours. So how do Kelsey-Seybold physicians communicate with patients, and how can patients communicate with physicians after hours?
So my Kelsey Online is open all the time. You can always send your physician a message, in the middle of the night, the weekend. Now, when a physician is off, they may not be checking their messages as frequently as during the week. So if you do have sort of, something that you really don't think can wait until your physician logs on to check over the weekend or on Monday, call our after hours nurse triage center. They have pretty good protocols for helping through, common questions. I mean, maybe it's something simple like, where did my prescription go? I don't know where, which pharmacy it went to, and I can't figure it out. And they can look at your chart, they can call the Walgreens or whatever it is and sort that all out for you. Now, if you have a question for them that they do not know how to answer, or that they're unsure of, or, if you just feel like you need to speak with a physician, they will get in contact with a physician because there's always a physician on call. During the evening hours, it's your physician. So So if you called right after clinic closed and you just missed me and you thought, oh my gosh, I completely forgot to tell Dr. Slaughter something, I'm kind of panicking, how can I get in touch with her? If you called the after hours services and said, this is my doctor, this is my question, and they weren't able to answer it, they would be able to get in touch with me in the evening hours. Now, if it was late into the night, we do have someone at nighttime that switches over. So we all take turns. So we're not always awake at night. So there's always a doctor on call, though. We're always available for your healthcare needs. Even if it's not your physician, they can still see your chart and still read about your past history and, know some of the details of your care and be able to give competent advice with that.
So can we talk a little bit about the different type of visits available to patients at Kelsey-Seybold? We know we have our in-person visits, virtual visits, e-visits. Can you talk a little bit about an e-visit and how you communicate with patients through an e-visit versus a virtual visit?
So I do a lot of virtual visits, which are the video conversation that we're doing, similar to what you're doing right now. You can see me on the screen. I can see you on the screen. We have a time designated to meet up, just like it was in an office visit. We log on at the same time together. We meet and we discuss what's going on. A lot of times I will ask you to identify yourself an extra time on the video, though, because we haven't looked at your license. We haven't checked you in and all that stuff. But it's very similar to an in-office visit, and then when you do an e-visit, I actually don't do a lot of those, but we have a PA here in the office that does a lot of those. So that's something more of where you fill out a form kind of explaining what your symptoms are. You're not having that face-to-face interaction. But I think that's a great outlet for something really simple like, oh my gosh, I'm out of my cream for such and such. I've been on this for years. I don't know that I need a visit. I just need this quick thing refilled. So that would be a perfect opportunity to do something like an e-visit if it was a very simple problem. Now, I mean, to be honest, if it was a more complex problem or you didn't know what was going on with you, I think a virtual visit or an in-person visit might be more appropriate, so we could kind of get to the bottom of what's happening. But simple things, an e-visit would be perfect. And same thing for a virtual visit. If you just wanted that connection to see somebody and kind of answer a few questions before you got your refills, that would be appropriate too.
Perfect. So let's talk a little bit more about anxiety in healthcare. We have some questions coming in about that. So we definitely just want to address that a little bit. We understand with COVID right now, there are some limitations on having people come with you and whatnot. But I guess, are there any other things besides, music or trying to find something to keep you busy, to take your mind off of it, that you can do to sort of prepare for your visit to ease your anxiety? Should you try to learn some medical terminology about maybe some of the questions you're going to be asking or anything like that?
I think that's kind of your physician's job, is to help you get onto the same page with what I'm thinking. Physicians learn a whole different language almost, I think, to, understand what's going on with your body, but I don't think it's your job to know that language. Your job is to kind of tell me what you're experiencing, tell me what your problems are, and I'm supposed to help you understand them in simple terminology. So I don't think you need to do a lot of homework. You just maybe need to, have all of your, things organized and ready to talk about. So, the biggest thing, that I'm trying to, I guess, obtain from a visit from you is not, do you know the medical terms I'm using? Do you understand the terminology here? But rather, what's happening with you? What's your experience? What can we help you with today? So if you can communicate that to me, my job should be to turn around and be able to communicate to you what I think is going on with your body in simple terms.
Here's another great question. It's regarding current medications that you're taking. Is it okay to bring your prescription bottles in with you to make sure that you remember everything and you're reporting them accurately to your physician?
I think that's a great idea, because unfortunately, many pills look very similar. There are many little white pills on the market. So people say it's a white one. I'm like, oh no, that could be anything. So I think bringing your pills is a fail-safe way, because if you have that prescription, there's no doubt as to what it is that we are talking about. Some people feel that they can't take all their medicines, or, maybe you have medicines that are refrigerated and, it's Texas, you're worried about them getting overheated. So another good way is to make up a very detailed list that you keep on your printer, and you print out, every time something new happens, that you can bring in, and it has the exact, directions that are on the label. And I think that's important to write the directions that are on the label, because sometimes there's a miscommunication, with the pharmacy. We write once a day, but someone, slipped and wrote twice a day. So knowing what label you have at your house is very helpful to me, to make sure that what I have in the computer is matching with what you have at your house.
What about vitamins and supplements? Should you bring those in as well, or is that not relevant?
I think that's important too. There are certain, medications and supplements that interact with prescriptions. So it's always good for us to know about those things. And there's certain vitamins that, can build up to a certain level in your system and maybe aren't, peed out. If, certain vitamins that are water soluble, if you take too much, you're just going to pee it out. But other vitamins, they're fat soluble, meaning they'll stay in your body and kind of build up to a level. So if you're on a vitamin that's fat soluble, at some point we may need to check that level. It just all of that, having that full picture in front of us certainly helps, if you're having some sort of side effect. If I don't know you're taking a supplement, but I know that that's a side effect of that supplement, there's a clue that we might be missing, even though we're talking to each other.
Awesome. Okay, so let's see. The next question that came in is about translation again. Can you request a translator prior to your visit?
Yeah, you can. I mean, that always helps too. If you let us know in advance, like, hey, I'm coming in and I speak this language, we can get the language line ready before you even come. Or, if we know that you're coming, we can make sure our certified Spanish translator is available, during that time frame, if that's something that you wanted to do. But again, if you get here and you're like, yeah, I think I do want to do that, no problem. We can go ahead and, start that at any point in the encounter.
Let's see. Reading through these questions, we have a few more coming in. This one is about after hours, which I think is a great question. If you have an emergency after hours, should you call your Kelsey physician or call 911 first?
Oh, that's a good question. I think it just kind of depends on the situation. I mean, if this is something that you can't wait for a call back and you need instant help, I think 911 is the way to go. But if it's maybe just like a quick medication question, or you're kind of like, oh my gosh, I don't know if I'm too sick, do I need to go to the ER? I'm kind of on the fence. I'm not really sure. That would be the perfect time to talk to the after hours triage center, just to kind of help, and they can help you assess what your situation is and whether or not it needs immediate care or could wait till the morning. So if you're kind of unsure and it doesn't seem like something that needs immediate attention, you could call the nurse. But again, if it's something that can't wait for a call back, then I would say go to the ER or call 911.
I really like this question that came in. It's about virtual visits and preparing for virtual visits. Would it be helpful to have a blood pressure cuff, a scale, a thermometer, and some of the basic other tools that you use in a doctor's office for a virtual visit to help give your physician accurate information?
Definitely. A lot of times too, some people, like I said, aren't comfortable coming into the office, during COVID, and, maybe it's just not a convenient time for them to get out of work. And so they've taken a quick break at work. So, I mean, if you have that information, your blood pressure and your weight, I mean, that always helps us kind of know a little bit more detail. So that brings it even closer to like an in-person visit. So if you're able to obtain a weight and your blood pressure and, any other, vitals that you have at home, please share when we call to set up your visit, or during the visit, say, oh, I did take my blood pressure this morning and this is what it was. And I took my temperature or my pulse, and we can include all that data in our visit to help us make it a more complete assessment of you.
This is a tech question that came in, and I'm not sure about it. So I think it's a relatively new issue. So I'm not sure, not new issue, but great problem to have. With the technology that's advancing with Apple Watches, the data that it's recording, pulse and heart rate and things like that, are those important for your physician to know? And should you be reporting those or linking those to MKO if that's possible?
I don't know if there's a way to directly link it to MKO just yet, where you just upload all the data. You can still do screenshots of data, of course, and attach that as a picture on My Kelsey Online. But, as far as sharing that information, I think that's valid information because, keep in mind, we only have, 15 minutes together here during our visit when we're in an encounter, but, you have the whole rest of the day and all sorts of things can happen. So if you see something on your Apple Watch or on your heart rate monitor that you think is concerning, please bring it up. It could be that that you noticed your heart rate was elevated, but you were also, on mile 6 of your run, well, that could be certainly an obvious cause. Or if you were, in an anxious state and your heart rate was up, again, we have a obvious explanation. But the technology is getting better and better. So actually, when it says, maybe there was an irregular beat, maybe there really was. It's not, just some old technology now. It's pretty accurate these days. So if you see something you think is concerning, definitely let us know. I mean, if your heart rate's the same every day and it's normal, I mean, I don't know that we need to keep a ton of tabs on it, but if you find something that you're worried about, please bring it up.
Perfect. All right, let's see. Scroll through a few more of these questions here. This is a great question. Are emotional support animals allowed during visits?
Ooh, I am not 100% sure. I haven't seen one in the office here, but it's been an interesting time. We haven't even allowed visitors, so I'm not sure. I would have to double check with our office staff and see what the official Kelsey rule is. I know service animals legally are, of course, welcome in all venues, but I don't know if emotional support animals are considered welcome at the visits. I would have to double check.
And then another question came in about visits and accommodations at the office. Can you request to dim the lights or things like that if it makes you more comfortable during your visit?
Of course. Yeah, we're happy to accommodate if turning off the lights or closing the blinds or, maybe talking in a louder or softer, we're here to try to make this a comfortable experience for you. So, I've even had people say, I'm kind of cold. We always keep the doctor's office cold. So, I mean, if you need a blanket, we have all those sorts of things here. So, let us know if there is something that you need or if you need a sip of water and any little thing, we'll try to make you as comfortable as you can be while you're here.
Perfect. Well, I think we've addressed most of our questions today. So we're going to go ahead and wrap up our conversation. I know you have patients to get back to, both virtually and in person, so we don't want to keep you any longer and delay any patients later this afternoon. But thank you to everyone who joined us today and to Dr. Slauter for talking to us a little bit about, communicating with your physician and easing anxiety, and also about all the ways you can make an appointment with your Kelsey physician. So to those of you who tuned in today, this is our last Care Connect Convo for the summer. We'll take a little break. We'll be resuming in the fall. So you'll either receive an email or you can look at our social media pages or our website to learn more about when the next event will start again in the fall. And Dr. Slauter, thank you again for joining us. And if you have any questions for Dr. Slauter or would like to make an appointment with her, you can call Kelsey-Seybold's 24/7 contact center at 713-442-0000 to make an appointment with her, or you can go on to our website at kelsey-seybold.com where you can make an appointment and you can also view her bio video. So thank you again, Dr. Slauter, and to everyone who joined us today. We hope you all have a great afternoon and a wonderful extended holiday weekend.
Thanks for having me.
Bye, everyone.